Welcome to another episode from the Veterinary Medicine Digest.
Yeah.
So, I want you to picture something for a moment. Just imagine a 4-year-old heavy black bull.
Oh, wow. Yeah, that is a massive animal.
Exactly. We are talking about a seriously powerful animal, easily weighing over 1,000 pounds, just built of sheer muscle.
Right.
But suddenly, out of nowhere, it's completely paralyzed.
Oh, that's awful.
Yeah, it is. It's just lying rigidly on its side in the dirt, entirely unable to stand up, no matter how hard it tries.
Yeah.
It's a terrifying scene, and I think it perfectly captures the stark, immediate, and, well, often heartbreaking realities of veterinary emergencies.
It really is a truly terrifying scene. And frankly, for a long time in veterinary medicine, it was an almost entirely hopeless one, too.
Right.
But today, our mission for this deep dive is to sort of look past the dirt and the struggling animal and focus on the microscopic war happening deep inside that spine.
Which is fascinating.
It is. We are going to unpack the doctorate-level biology of what actually happens during a severe spinal trauma. We will examine the initial impact, sure, but more importantly, we are going to expose the destructive cellular cascade that follows.
That secondary wave.
Exactly. And then we will explore how an incredibly unexpected therapy, specifically utilizing hydroxyprogesterone, brought this completely immobilized bull back to its feet in literally just 7 days.
Which is just wild to think about.
Yeah.
And for you listening, this is where the story gets incredibly relevant, whether you work at a clinic or, just have a deep curiosity about biology.
Absolutely.
Because this fascinating case study completely changes our understanding of nerve repair. It opens up the hidden potential of repurposing everyday hormones that are, already circulating in our bodies right now.
Right. It's a total paradigm shift.
So let's unpack this from the very beginning. When we think of a broken back or a severe spinal injury, we naturally picture a clean break.
Like a snapped twig.
Exactly. We think of a snapped electrical cable. But the biology is so much darker and so much more complex than a simple snapped wire.
Far, far more complex. I mean, the pathophysiology of spinal cord trauma is actually divided into two distinct cascading phases.
Okay.
So the first phase is the primary mechanical injury. This is the acute compression, the violent physical impact, the sheer force applied to the delicate tissues of the spine.
Right, the actual hit.
Yeah. But here is what is genuinely fascinating and honestly a bit counterintuitive for most people to grasp.
What's that?
That primary mechanical force surprisingly rarely severs the spinal cord completely.
Wait, hold on. Are you saying the initial hit, the actual trauma itself, doesn't usually cut the cord in half?
Precisely. I mean, the initial physical blow is undeniably terrible. It causes immense bruising and immediate trauma.
Right.
But it is very rarely the mechanism that causes the permanent total paralysis we usually associate with spinal injuries. The real killer, the true enemy in this scenario, is the secondary injury.
Wow. Okay. So the initial blow is really just the beginning of the nightmare. It's just the catalyst.
Exactly.
What exactly is happening during this secondary cascade that makes it so much worse than the initial impact?
Well, it is a catastrophic, multi-tiered biochemical failure, and it unfolds mercilessly over hours and days. First, you have severe ischemia.
Which is essentially a biological blackout, right? Like a devastating lack of blood flow to the spinal tissues.
You nailed it. Because of the initial bruising and compression, the local blood vessels are compromised.
Oh, I see.
Yeah, so without blood, the delicate spinal tissues are starved of oxygen and vital nutrients within minutes. But the blackout is just the first domino to fall. Next comes the vasogenic edema.
Edema meaning swelling.
Right, but not just a little swelling. We were talking about widespread, crushing swelling inside a closed bone tube.
Oh, because of the vertebrae.
Exactly. The barrier between the blood and the spinal cord physically breaks down. This allows fluid and large, heavy plasma molecules to flood directly into the incredibly delicate nervous tissue.
That sounds bad.
It's terrible. Because the spinal cord is encased in the rigid bone of the vertebrae, this excess fluid has absolutely nowhere to go.
Right. It can't expand.
Exactly. So it drastically increases the pressure inside the spinal canal, which physically chokes off whatever tiny trickle of blood supply was even remaining.
Okay, so if I'm understanding this correctly, the primary injury is essentially an initial earthquake. It does some immediate structural damage, maybe knocks down a few buildings and cracks the roads.
That's a great way to picture it.
But the secondary injury, that is like the subsequent fires and the massive flooding that sweep through and actually destroy the city infrastructure long after the ground has stopped shaking.
That is a brilliant analogy. The flooding and the fires do the vast majority of the irreversible damage.
Wow.
And to stick with your city infrastructure analogy, as those cells are starving and drowning under immense pressure, they begin to panic.
Cellular panic.
Yeah, they lose their ability to regulate their internal chemistry. And this leads to a massive toxic flood of glutamate.
Glutamate. Wait, isn't that a normal brain chemical?
It is. Glutamate is normally a highly functional excitatory neurotransmitter. I mean, it is literally how nerves talk to each other under normal conditions.
Right, I've heard of it.
But in these massive, uncontrolled quantities, it literally becomes a poison. It overexcites the surrounding nerve cells, forcing microscopic gates on their cell membranes, which are called ion channels, to lock wide open.
Oh boy. And what happens when those gates get stuck open?
Lethal levels of calcium flood into the cellular interior.
Calcium.
Yeah. Now, calcium is obviously essential for life, but too much inside a neuron acts like a wrecking ball. This calcium overload specifically targets and destroys the mitochondria.
Which are the tiny powerhouses generating energy for the cell.
Exactly. And as the mitochondria die, they release highly reactive oxygen species, which are essentially microscopic shrapnel that tear apart the cell membranes from the inside out.
That sounds incredibly violent.
It is. Ultimately, this violent excitotoxicity forces the surviving neurons to activate a failsafe. They undergo programmed cell death, which is a tragic process of cellular suicide known as apoptosis.
So the floodwaters are toxic, causing the surviving buildings to basically detonate themselves.
Yeah.
That is horrifying.
And it gets even more complicated, believe it or not.
Oh, of course it does.
The body senses this widespread destruction and goes into absolute emergency lockdown. It sends in specialized support cells from the nervous system called astrocytes and microglia.
Okay.
They rush to the site of the damage. Their entire goal is to wall off the necrotic, dying tissue to save the rest of the healthy spinal cord from that spreading toxicity.
Okay, so going back to our disaster analogy, this is like the firefighters rushing in and digging a deep trench. They are basically sacrificing a section of the forest to stop the fire from taking the entire mountain.
Exactly right. They tightly interweave their cellular branches, forming a physical barricade. We call this the glial scar.
Which, I mean, sounds like a heroic effort by the body. They are containing the disaster area.
In the short term, yes, it is absolutely essential for survival. But here is the tragic irony of the glial scar.
Oh.
As those astrocytes form that protective wall, they secrete complex sugar molecules called chondroitin sulfate proteoglycans.
Wow. That sounds like a really heavy piece of biological hardware. What do those molecules actually do?
Well, think of it as the firefighters pouring a thick, impassable wall of toxic concrete into their trench.
Oh, wow.
It stops the fire, yes. But when the surviving nerve fibers, the vital communication cables we need, eventually try to grow back and reconnect the city, they hit this physical and chemical wall.
They can't cross it?
They are completely stopped in their tracks. The glial scar literally prevents any new nerves from growing through the injury site.
That is incredibly frustrating from a healing perspective.
Yeah.
So the body's own desperate defense mechanism permanently traps the patient in a state of paralysis. But wait, there is a highly optimistic detail from the research we reviewed for this deep dive, right? Something about how many cables actually need to cross that trench.
Yes, and this is perhaps the most crucial point for understanding why recovery is even possible at all.
Okay.
The research notes that only 5% of the original nerve fibers might be needed to maintain functional physical movement.
Wait, pause right there. I want to make sure I'm hearing this correctly.
Sure.
You were saying that 95% of the spinal cables can be completely fried by the fires, the floods, and the toxic concrete.
Yep.
And as long as just 5% survive and reconnect, a 1,000-pound animal can still stand up and walk.
That is exactly what the neurology tells us. It is an incredibly low threshold for functional recovery.
That's insane.
Right. If you can preserve just a tiny fraction of those axons from the secondary wave of destruction, if you can protect them from the swelling and the toxic calcium, the animal, or a human patient for that matter, retains the basic neural substrate needed to move.
That means there is immense hope. The goal isn't necessarily to regrow the entire spinal cord from scratch.
Exactly.
The goal is just to halt that secondary damage.
Yeah.
We just need to put out the fires and stop the flooding before that glial scar sets in stone.
Precisely.
So if the secondary cascade is doing all this irreversible damage, there must be a standard protocol to stop it, right? What is the medical go-to emergency button?
Well, historically, for decades, the traditional medical approach revolved heavily around the use of glucocorticoids, specifically a powerful synthetic steroid called methylprednisolone.
Right, because steroids are famous for shutting down inflammation and reducing swelling across the whole body. They seem like the obvious heavy-duty fire hoses for this kind of catastrophic swelling.
They certainly do, and honestly, they have been the standard of care for a very long time, specifically to attack that devastating early edema we talked about.
Makes sense?
However, we must highlight the immense controversy found in the recent research. Modern medical guidelines strongly warn against using high doses of these steroids in spinal trauma.
Really? Why? I mean, if they reduce the swelling that chokes the spinal cord, why are we moving away from them?
Because the clinical evidence shows that while they might offer modest short-term benefits in reducing that inflammation, they carry severe and genuinely life-threatening side effects.
Oh, wow. Like what?
Well, when you use steroids at the massive doses required to actually penetrate the spinal cord, you trigger profound systemic issues. We are talking about catastrophic immunosuppression.
Leaving the patient incredibly vulnerable to infection.
Exactly. And they can cause severe gastrointestinal bleeding plus massive metabolic disruptions. Often, the systemic risk to the patient completely outweighs the local reward to the spinal cord.
Okay, so the fire hose might put out the local fire, but it sprays with such force that it washes away the entire foundation of the house.
That's exactly it.
That is a terrible trade-off in an already critical patient. So if we cannot rely on massive doses of steroids, what else has been used?
Another cornerstone of traditional therapy is methylcobalamin.
Okay.
This is a highly active, water-soluble form of vitamin B12.
I know vitamin B12 is popular for, energy metabolism, but what does it do for a crushed spine?
Methylcobalamin is crucial because it acts as a primary methyl donor in cellular metabolism.
Okay.
In simple terms, it provides the essential biological building blocks for synthesizing myelin basic protein.
Myelin being the protective insulation wrapping around the nerve fibers.
Exactly. Think of myelin like the rubber coating on a copper electrical wire.
Right.
It protects the wire and allows the electrical signals to travel quickly and efficiently. When nerves are damaged in that secondary cascade, this myelin sheath rapidly degrades and breaks down.
So the wires are exposed and
Yeah.
they short circuit.
Yes. Methylcobalamin provides the raw materials to slowly rebuild those myelin sheaths. It also has a secondary, very beneficial effect of downregulating pain receptors.
Oh, that's helpful.
Very. It helps manage the agonizing neuropathic pain associated with nerve damage.
Okay, I have to ask a pointed question here because I feel like the math is just not adding up.
Go for it.
If standard steroids are too dangerous to use in the high doses required to stop the swelling,
Right?
and vitamins like vitamin B12 only aid in the slow, gradual repair of the myelin insulation over weeks or months,
Yeah.
then what is the missing link? Because it sounds like we have one treatment that is far too toxic and one treatment that is far too slow.
That's true.
Neither of those explains a fully paralyzed 1,000-pound bull miraculously getting up and walking in a single week.
That is the perfect question to ask, and it leads us directly into the core of this deep dive. It really points us to the turning point in modern neuroprotection.
Okay.
Because you were right, steroids and vitamins are not enough. The unexpected hero here, the actual missing link, is progesterone.
Progesterone. Are you serious?
I am absolutely serious.
Okay, wait. We're talking about a hormone universally known for managing reproduction, the menstrual cycle, and pregnancy.
Yep.
How can that possibly fix a severely traumatized spinal cord? I mean, that sounds like trying to use a wrench to paint a house. It feels like the completely wrong tool for the job. I know.
How does a pregnancy hormone even access the brain and spine?
I completely understand the disbelief. It sounds entirely counterintuitive, and for a very long time, the medical field thought the exact same thing.
Oh, really?
Yeah. But what is truly fascinating here is that progesterone has a profound secret double life. It is not just a reproductive hormone circulating in the blood, it is actually a highly potent neurosteroid.
A neurosteroid, meaning it originates inside the nervous system itself.
Precisely. It is synthesized right inside the central and peripheral nervous system.
Wow.
Those same glial cells we talked about earlier, the astrocytes building the scar, they can actually produce progesterone locally.
I had no idea.
And its advanced mechanics in the context of severe trauma are just nothing short of miraculous. It works on multiple different levels simultaneously.
Like what?
Well, first, it actively restores crucial functional markers within the damaged spinal cord. For example, it massively upregulates the expression of brain-derived neurotrophic factor. Okay, let's break that down. Brain-derived neurotrophic factor. What is that doing on the ground floor of the injury?
It is a critical survival protein. When a nerve cell is damaged, this factor acts like a biological megaphone, actively preventing neurons from undergoing that cellular suicide we mentioned.
Right, the apoptosis.
Exactly. But more than just survival, it actually stimulates the surviving nerve fibers to sprout new branches and reach out across the damage.
So it's not just putting out the fire, it's actively telling the surviving cells to stay alive and immediately start rebuilding the communication network.
Exactly. And it goes further. Progesterone also restores the sodium-potassium pump.
The what?
It's a microscopic engine located on the membrane of every single nerve cell. It constantly bails out sodium and pumps in potassium to maintain the exact electrical charge the neuron needs to fire a signal.
Okay, so it's maintaining the battery.
Right. When the spinal cord is injured and loses oxygen, this microscopic engine fails. The cell loses its charge and just goes dead.
That makes sense.
Well, progesterone actually forces this pump back online, restoring the cell's physical ability to fire electrical signals.
That is incredible. It literally gets the power plants running again.
Yeah.
But what about the swelling and the immune system attack?
It handles that beautifully. Progesterone blocks the inflammatory cascade at a fundamental genetic level.
Really? At the genetic level?
Yeah. It literally reduces the expression of specific inflammatory cytokines. By silencing these chemical alarms, it commands the body's immune system to stand down and stop attacking the injured tissue.
So it's acting like a master diplomat, stepping between the immune system and the spine, preventing the friendly fire that causes so much collateral damage.
That's a great way to describe it.
And the edema, the crushing fluid pressure.
It physically stabilizes the barrier between the blood and the central nervous system. It regulates specific water channel proteins to drastically reduce the accumulation of fluid in the tissues. It shuts down that life-threatening swelling far more safely and effectively than traditional glucocorticoid steroids, and without destroying the patient's immune system or gut lining in the process.
That's amazing.
Furthermore, it prompts local precursor cells to mature into healthy myelin-producing cells. This instantly jumpstarts that remyelination process we want the vitamin B12 to support.
Okay, so progesterone is secretly this master architect, diplomat, and emergency responder, all rolled into one molecule.
Yep.
It reduces swelling safely, stops the inflammatory friendly fire, tells dying cells to survive, and forces the insulation to rebuild. That is unbelievable.
That really is.
So let's take all of this dense biology and bring it back into the harsh reality of a farm or a clinic. Let's look at the 2026 case study of the paralyzed bull.
Right, because theoretical biology is wonderful, but this case study perfectly illustrates the sheer, undeniable power of this neurosteroid in a messy, real-world clinical setting.
So let's set the stage. We are back in the veterinary clinic. The doctors are presented with this 4-year-old massive black bull. The owner reports it just suddenly went down.
Yeah.
It is in what veterinarians call lateral recumbency, meaning it is just lying flat on its side in the dirt, completely stiff.
Right.
Now, examining a frightened animal of that size is incredibly dangerous, but the clinical examination revealed some very specific clues.
What did they find?
Well, the bull had diminished, weak reflexes in its front legs, but it had exaggerated, hyperactive, stiff reflexes in his hind legs.
Ah. And if we connect this physical exam back to the bigger picture of neurology, that specific combination of symptoms is a massive glowing clue.
Oh, really?
Yeah. In large animal neurology, finding diminished reflexes in the front limbs combined directly with exaggerated, kicking reflexes in the hind limbs points exactly to a lower neck injury.
Wait, how does that combination pinpoint the neck?
It localizes the lesion to the cervical spine, right between the 6th cervical vertebra and the 2nd thoracic vertebra.
Okay, but why?
Here's why. The injury crushed the lower motor neurons right there in the neck that directly control the front legs.
Which causes those front reflexes to go weak and diminished.
Exactly. But at the same time, that crush injury severed the long upper motor neuron pathways traveling down the cord.
Okay.
Those long pathways normally carry a signal from the brain telling the hind legs to relax. Without that relaxing signal from the brain, the hind legs go totally stiff and hyperactive.
Oh, I see. So just by tapping the legs, they knew exactly where the catastrophic damage was, even without advanced, expensive imaging like an MRI machine.
Exactly.
Which is rarely practical or even physically possible for a 1,000-pound bull anyway.
Definitely not.
So they have their diagnosis, a severe cervical spinal injury. Let's walk through the treatment timeline day by day, because this is where the theory has to save a life.
Let's do it.
On day 1, the veterinarians initiated standard crisis therapy.
Right, they had to stabilize the patient systemically before anything else.
They administered massive amounts of intravenous saline to maintain blood pressure and keep the organs hydrated.
Standard protocol.
They gave broad-spectrum antibiotics because an animal lying in the dirt is incredibly prone to secondary respiratory or skin infections.
Of course.
They administered a carefully calculated short-term dose of intramuscular prednisone, which is a traditional steroid, trying to control that immediate, life-threatening swelling without causing ulcers.
Right, managing the risk.
And they gave massive doses of intravenous methylcobalamin to flood the system with the building blocks for nerve repair.
Exactly. That is textbook emergency management. They were simply trying to survive the initial crisis.
Okay, so that was day 1.
And by day 2, there was a slight, very minor improvement. The bull could lift its head off the ground, and it was actually willing to eat some hay.
Which is a fantastic sign that its gastrointestinal system was stable.
Yes, but neurologically, it was still completely trapped in its own body. It could not use its legs at all.
Oh, no.
In fact, to prevent its immense body weight from crushing its own internal organs, the veterinary team had to use heavy machinery to hoist the bull into a heavy-duty mechanical support sling.
Just to keep it upright in a sternal resting position.
Exactly.
I want to linger on that for a second. Imagine the tension and the physical labor in that clinic. You have a massive panic prey animal suspended in a mechanical sling.
It's intense.
The standard treatments have kept it alive, but they aren't fixing the paralysis. The clock is really ticking before the complications of just being immobile become fatal.
Absolutely.
But then we hit the dramatic turning point. On day 3, the veterinarians decided to try something radical. They added the missing link.
They did. They administered a single intramuscular injection of hydroxyprogesterone at a dose of 5 milligrams per kilogram of body weight.
And the results were almost immediate, completely defying every standard timeline for spinal recovery.
It's astounding.
By day 4, just 24 hours after that progesterone injection, the bull was actually standing.
Wow.
It was unsteady, sure, it was wobbling, but it was bearing its own immense weight on all 4 legs.
That's huge.
And by day 7, the bull was walking completely on its own without any assistance from the mechanical sling.
It is an absolutely incredible clinical result, and I think it perfectly validates the incredibly complex molecular biology we just unpacked.
Right.
What we are seeing in this timeline is the profound, undeniable impact of synergistic healing.
How so? How did the elements actually work together?
Well, the early, careful use of standard steroids likely blunted the very worst of that initial crushing wave of vasogenic edema on day 1.
Okay, so putting out the biggest fires.
Right. Then, the heavy doses of vitamin B12 flooded the local environment with the raw materials desperately needed to rebuild those degraded myelin sheaths.
Gathering the supplies.
Exactly. But the hydroxyprogesterone on day 3 was the ultimate catalyst. It entered those traumatized tissues, rapidly stabilized the nerve cell membranes to stop the swelling, commanded the cells to halt their programmed suicide, and just supercharged the neurological regeneration process.
It was the master switch.
Exactly. It was the master switch that turned a pool of raw materials and a stabilized environment into functional firing nerve pathways.
Pathways capable of lifting 1,000 pounds in a matter of days.
Yeah.
It is truly astonishing.
Yeah.
You know, when you start this journey by looking at a helpless, paralyzed animal lying in the dirt, it feels entirely hopeless. It feels permanent.
It really does.
But understanding the deep molecular biology of nerve damage completely changes that perspective.
Oh, 100%.
Knowing that there are microscopic pumps and specific genetic switches and biological diplomats that can be manipulated to stop cellular suicide and actually force regeneration.
Yeah.
It makes the image of that once paralyzed bull walking out of the clinic even more miraculous.
Yeah.
It's not magic. It's hard, complex biology.
Yeah.
But when you see it work, it absolutely feels like magic.
It really does. And I think this case raises a tremendously important, highly provocative final question for us to consider.
What's that?
If a common reproductive hormone, a molecule we associate almost entirely with the routine process of pregnancy, holds the sheer biological power to regenerate severed neurological connections and bring a massive, completely paralyzed animal back to its feet, what other everyday biological molecules currently circulating in our bodies right now are hiding miraculous regenerative properties just waiting to be unlocked by science?
Thank you for listening. The titles for the reference papers are in the video description. From Vet Med Digest, where we keep minds inspired, hearts light, and tails wagging,